I go to Ms. Jacques for the Liberals for 5 minutes, please, Helena.
Thank you very much, Madam Chair, and thank you to the officials for being here. Now, I'm relatively new to this committee, and I'm not really familiar with the background of requesting the officials to be here today. But what has struck me is that what we're being presented with does not in any way reflect what was in the 2025 budget in terms of cost constraints, and particularly as it relates to the supplementary benefits and co-payments and so on. So this is clearly a very initial or a study based on data that preceded those changes that our new government has made. And I think you've said that, Monsieur Jacques. Could you confirm that this does simply not include some of the changes that our government is proposing to make?
That's correct. That formed part of my opening statement.
Right. So having said that, I presume we're here to dig a little bit into the data that you used, excluding, obviously, as we've said, the new provisions. MP Strauss, as an example, gave you some information that he has apparently that billing is not consistent necessarily in anesthesiology, in accordance with the Alberta Medical Association billing code. Like, were you aware that there could be issues that patients in Alberta billed a certain amount or that they are insured for that amount, and that the federal government was paying in excess of that type of standard billing?
So again, I believe in my opening statement, I indicated that we assumed that the program was being administered in the manner that the government intended. In terms of the billing records, we did not request, nor did we go into the billing records. And in cases of potential malfeasance, that's more of an issue that is under the purview of the Auditor General of Canada.
Would you be able to look into that? As an example, if you now you've heard about it, you might want to inform the government of your findings.
Sure. Again, with a motion from the committee, we'd be happy to undertake additional work and additional analysis.
Okay, I think this would be very helpful, because what we have in front of us was based on old data, and obviously we're here to potentially make some recommendations. Now, when it comes to supplemental coverage, is there any particular aspect of that coverage? Is it physio? Is it drugs? Is there any area that particularly stands out as being different from a coverage perhaps in the general population? I presume you compare in some way.
For this analysis, we didn't request a very granular breakdown of the supplementary spending. So we haven't done any analysis.
So you don't know if I
No.
see. I see. Yes, well, it really is quite preliminary, isn't it? Okay. There has also been an assertion that coverage would extend for 4 years. I presume this is an average for all beneficiaries. Is that correct? So in the case, I think, Madam Chair, we would assume that if someone has been charged criminally, as was potentially described by a member opposite, that removal from this country might be considerably shorter than 4 years. I suppose that's not an area of your expertise, but
no, we don't have. That's a question better put to CBSA officials.
So that 4 years was what was that based on then? 4 years of coverage.
So in the information we got from IRCC, we asked for average duration of coverage, and for the fiscal year 24-25, they indicated that the average coverage duration is 4 years.
For all claimants?
For asylum claimants, beneficiaries.
I see. Okay. In your analysis, is there any... Do you look at inflationary costs or something? Because you projected through to 2029, 2030. Did you consider rate of inflation in any of these costings?
Yeah, absolutely. That's definitely something we looked at when, deciding how to project that forward. So our projection includes, inflationary pressure, usage pressure, and also adds to that sort of the additional trends we've been seeing in the cost increases historically.
Thank you.
Thank you very much, Ms. Jacques. I now go